If a person doesn't have to pay, will he worry about being overcharged?
Of course not.
It doesn't matter. So people are constantly being overcharged when the government program is providing the payment, and the government is getting ripped off in that sense.
Let me say this, for sake of concluding this portion of the show, I will concede to you that there are probably some very mentally ill people that just wait for an opportunity to rip off the federal government by seeing doctors and nurses for treatment that they don't really need.
No, I think it's the providers that are doing that. They don't care.
I don't know.
The person that's going there doesn't really care whether he's overcharged or not. It's the provider who's actually doing the ripping off, and he's the one that's getting the benefit. Let me say this, Jan. One of the benefits that we have in the Congress is that we bring a lot of experts. We hear them because we don't have personal knowledge about what can happen under different types of laws. And people like you are provocative, and they try to raise situations, and we try to figure out what happens. So far, and you're just going to have to take my word for it, we have not been threatened by the possibility that people will just like to take advantage of free health care, as you said, and taking advantage of free food or free boats or free cars. We really don't think that there's going to be an avalanche of people seeking health care that really don't need it because it's free. Now, we may be wrong, but so far, as you and I talk, we don't have a bill in the Senate. And we're only talking about a bill that has been reported out of committee, but has not been voted on by the House. Okay, well, let's look at the experience so far with Medicare and Medicaid. I saw a study done by the Brookings Institute where before Medicaid and Medicaid went into effect, the poor went to the doctor less often than the non-poor. That makes sense because they have less money, right? But after Medicaid and Medicare, the poor were going to the doctor not at the same rate as the non-poor, but even a higher rate, about 20 or 30% more than the non-poor.
So yeah, that makes a lot of sense to me.
For some reason, they were going to the doctor even more often, and they were also receiving surgical interventions at a higher rate than the non-poor. So it apparently, the fact that something is free will make people use it more often, and they won't pay attention to price. They won't shop around.
No, that's not a logical argument just based on what you've told me. I could tell you this, and you know it's a fact, that poor people have a tendency to contract more illnesses and disease and to be more sickly than better off people. And you would see that.
But why are they having more operations? You said people don't like to have operations, right? Well, I agree that nobody likes to have operations, but
Jan, there's a very simple answer to this. If you're poor and you can't afford to go to a doctor, and you have kidney failure or you have a heart problem, if you don't go to the doctor, you won't have any surgery. Why? You just die.
Would you say that a person that doesn't have to pay for a service will use it more often or not? And will they worry less about price if they don't have to pay than if they have to pay?
It answers itself. As I talk with you, I have a problem with my stomach. I am insured. And you can bet your life I'm going to take advantage of my little card and I'm going to visit with a doctor. On the other hand, if I was not insured, I'll see what happens tomorrow and the day after, maybe a week, and it could be by the time I figured I could afford to go to a doctor, I would have had an ulcer. And so what I'm saying, Jan, yes, if I had no insurance, I would stay here with your piercing questions and develop an ulcer. But because I'm so pleasant about this thing, it's because as soon as you leave, I'm going to a doctor.
Okay.